Hello, my name is Amanda Unruh. I'm a Doctorate of Occupational Therapy student at Nova Southeastern University in the Sensory Processing Basis of Occupational Performance class. So today I'll be talking about what sensory integration is and what sensory processing disorders are and how they appear in one's life. So sensory integration is also known as SI and is how our body is able to organize the sensations in order to use them. So through taste, sight, hearing, sound, touch, smell, movement, gravity, and position, our bodies are able to organize the information that they are receiving. So when these sensations are organized efficiently, our body is able to form perceptions, learn, and also form appropriate behaviors. So adaptive responses are goal-directed and purposeful responses to sensation, and they are important in sensory integration since they help the brain develop and organize itself. So, when all these sensations are not organized well and the brain is unable to use them efficiently or understand them, sensory integration disorder, which is SID, or sensory processing disorder, which is SPD, occur. So, a child who has SID, say in infancy, they'll meet all the typical development milestones, but just at a slower pace. So say a child is crawling, creeping, standing, sitting, walking, the child who has SID or SPD will still do all those things. It's just going to occur later on than their peers. Or if you're looking at school-age children, say they are skipping or galloping or hopping and stuff like that, these children will still do it. They'll just look unskilled or ungraceful, possibly compared to their classmates. They can still do it. It's just not going to be the same or as graceful since their bodies are getting all these sensations, but they're not sure how to integrate them to make it all as a whole to get that skill or grace in order to hop or skip or gallop. So hypersensitivity and hyposensitivity also occur with SPD and SID. So say a child was hyposensitive, that means they are going to need a lot of a stimulus in order to remain calm or stay alert or just to organize themselves. If they're hypersensitive, they're going to need less of that stimulus. So say we were looking at vestibular input, a child who's hyposensitive is going to need a lot of swinging, a lot of that movement, compared to the child who's hypersensitive. They're going to need a lot less of it in order to stay alert, calm, organized, whatever. So then when we're also talking about sensory integration, it's important to remember that every child is different and that these signs and symptoms will present differently, and the struggles each child will have will be different since everyone is different. It is also important to remember that SID and SPD is not caused by physical damage, and that the child's response when it seems like they're acting out is more reflexive than behavioral. So an example of this would be, say you're out at the store and you see a child who looks like they might be throwing a fit, biting, screaming, kicking on the ground. It's important to remember that if they do have SID or SPD, it is more of a reflex than a behavior thing. So they're acting like that. It's how their body is like trying to organize the sensations the best that it can, since this is going on, that this is what their body needs, and it's not they're just having a fit right then and there. Thanks for watching.